Dear friends, welcome to Know Thyself YouTube channel. Good morning. Hope you're all staying safe and keeping well. I sincerely thank all of you who have subscribed to this channel and follow the channel. If you find the contents of the videos uploaded in this channel useful, please subscribe to this channel and click the notification or the bell icon so that you can be notified when a video is uploaded. Kindly share the videos with others or on the internet. In the last 12 episodes of Know Your Mind segment, we presented an overview of personality disorders, their types and groupings, and specific analysis of 10 different types of personality disorders. In this episode, we begin our analysis of communication disorders or CD by presenting an overview which includes a general statement of its nature, characteristics, causes, symptoms, diagnosis, treatment, prevention, and prognosis. Communication process enables a person to pass on information, express their ideas and feelings, and understand other people's ideas and emotions. Hence, communication disorders or CD involves an interruption of the normal communication process in a person, thereby disrupts a person's ability to communicate properly. Thus, communication disorders are a group of neurodevelopmental conditions that affect a person's ability to detect, receive, process, send and comprehend concepts, symbols, and information necessary for communication in the areas of hearing, language, and speech, which include concept formation, verbal communication, non-verbal communication, communication through graphic language, and communication through speech. Thus, communication disorders mean that a person has difficulty with speech, communication, language, or a combination of some of them. These include impediments in grasping social cues, facial expression, gestures, emotional perception, language comprehension, word articulation, written language, or understanding and participating in verbal and non-verbal communication. Communication disorders most commonly occur early in a child's development and can persist into adulthood, or it can develop at an older age due to a medical condition such as neurological damage due to a stroke or brain hemorrhage. They can occur as a standalone condition in a person or can co-occur with other developmental disorders. The severity of communication disorder symptoms ranges from mild to profound. For instance, it can be as limited as a slight stutter or as severe as the inability to use speech or language to communicate. It is estimated that 1 in 10 children, that is approximately 6 million children, suffer from some type of communication disorder. Most communication disorders begin for different reasons, and mental health professionals are not able to pinpoint the exact cause of these disorders. Many people are born with these disorders. For others, communication disorders begin during early childhood development, while in older persons they can develop due to some serious medical condition. Hence, genetic, developmental, or acquired conditions can contribute to the origin of communication disorders. Here is a list of possible contributing factors. Exposure to toxin while the fetus is in the womb of the mother. Premature or traumatic birth. Developmental delay. Traumatic brain injuries or tumors in areas of brain responsible for communication, stroke, brain hemorrhage, brain injury, or other neurological health condition, structural impairments such as cleft lip or cleft palate, vocal cord injury due to misuse or abuse, viral diseases, genetic variants in specific individuals, oral motor dysfunction, hearing loss or deafness, autism, drug abuse, cerebral palsy, and intellectual and learning disabilities. There are different types of communication disorders, and each type would have its specific symptoms. Besides, each person may experience symptoms differently. However, most of the communication disorders share common impairments in verbal and non-verbal communication, displaying difficulties in areas such as language comprehension, speech, social cues, facial expression, gestures, and emotional expression. Communication disorder symptoms also include repetitive sounds, misuse of words, inability to communicate in an understandable way, and inability to understand messages. For instance, children with communication disorders have difficulty understanding symbol directions, unable to name objects, or have problems in communication, and teenagers may have difficulty with understanding and expressing abstract ideas. Symptoms of communication disorders may resemble other medical conditions. Hence, always one must consult a child doctor for diagnosis. Diagnosis of communication disorders may require inputs from several specialists such as physicians, neurologists, and speech-language pathologists. Common tests they administer include a complete physical examination including ear, nose, and throat, psychometric testing for reasoning, thinking skills, and cognitive abilities, speech and language tests, magnetic resonance imaging or MRI, computer tomography scan or CT scan, and psychiatric evaluation. Besides, doctors also may compare a child's language with the age and communication milestones and checklists to make sure if the child is in par with the expected skills and abilities at a particular age. After ruling out any physical cause for the communication disorder symptoms, in the light of the above administered test results, a speech-language pathologist will determine whether a communication disorder is present and suggest a specific treatment plan in the light of the type of the communication disorder and the severity of patient's condition. The best way to approach treatment for a communication disorder is to focus on early intervention in which the therapists, support staff, and family members of the patients work together to create a specific plan to help patient to develop a strategy for better communication. However, the specific approach to treatment of communication disorders in children, teenagers, or in adults will depend on the type of disorder and the severity of the communication disorder symptoms. It calls for treating underlying physical causes such as infections or other impeding physical conditions first with the help of medications. When the expected progress is made in the physical condition, the speak-language pathologist can begin speech-language therapy either one-on-one setting or group setting. It also involves social skills training to build clients' existing strengths. Treatment can also involve the client learning remedial techniques to improve weak skills. Alternative forms of communication, such as sign language, can also be taught to the patient to improve the communication ability. Group therapy with a family, peer group, or other groups significant to the clients could be done to allow the clients to test their skills in a safe environment. All these elements of therapy would help the clients developing phonology, controlling of language acquisition, and expanding their speech and written language skills. Specific preventive measures to reduce incidence of communication disorders are not known. Hence, there is no precise ways to prevent communication disorders. However, avoiding known risk factors such as anything that may cause injury to the brain by living a healthy lifestyle, lowers the possible occurrence of communication disorders. Likewise, early detection and intervention can address the developmental and academic difficulties and improve the quality of life of children, teenagers, and adults suffering from communication disorders. Prognosis and long-term outlook for communication disorders depend on the cause of the disorder and the severity of the symptoms. For children and teenagers, the combined efforts of parents, teachers, and speech language pathologists to create a better atmosphere to cope with patients' condition can be helpful in the long term. For adults, besides the support of others, self-motivation and commitment to the treatment plan can be helpful in the long term. In the next episode, we will take up for consideration the classification of communication disorders. Thank you for watching this video. Stay blessed until we see you again with another video.